I am back with Dr. Eric Westman, and today's question posed to Dr. Westman is, who would need medical monitoring when implementing or following a low-carb or ketogenic diet?
Well, that's a great question. I'm asked that frequently, and I would say at this point, my understanding of the keto diet is that it's healthy eating. So if you don't have a medical problem, you're not on medications, you don't need medical monitoring. Anyone can do this kind of diet. It's just real food that gives you great nutrition. I get the questions, can a child do this? Can my family member do this? I just see it as healthy eating. What makes me worried is that if someone is taking a medication that can become too strong or that can cause side effects in addition to the diet, then they need medical monitoring. Just as background, in my clinical setting, I will check laboratory tests to make sure that these conditions or issues like good kidney function, good liver function, good blood sugar control, that all of these are normal or controlled before they get started. So you want to be sure that if you have those kinds of medical problems like diabetes, high blood pressure, that you're monitored, that they're in good control, because it may not be the diet that's causing the problem, it's the medications that do.
So if somebody embarks on this program and let's say they are taking some sort of medication for either high blood pressure, which I know is an important one, or they're taking medications for type 2 diabetes, and they decide that they're going to try to do this on their own and they do not get monitored by a doctor, what sort of consequences could they encounter?
Well, if someone doesn't really understand diabetes and how the blood sugars are affected by the medication, they can have life-threatening low blood sugars, these people with diabetes on medication. So it could be quite dire. So now the medical monitoring for diabetes and high blood pressure, I think the diabetes gets faster quicker. So, but blood pressure can improve in a matter of days to weeks. The blood sugar gets better in a matter of hours to days. So you have to have better immediate reduction or understanding of how the medications can affect diabetes more so than the high blood pressure. But I've never seen a case of ketoacidosis in my research or in my clinic. This is when the ketone levels go very high and it's life-threatening. It's usually associated with type 1 diabetes, where they have no insulin at all. But I've seen this now in type 2 medications. There's a new type of medication that makes the kidneys leak urine, and they have a consequence of kidney contributed to ketoacidosis, even if you're not doing a low-carb diet. So that's another issue of, if you're not feeling well, you're doing it, see someone who understands the diet, because there may be an issue that you didn't think of, or that even the internet doesn't teach you about, and that medical person would be able to help you figure out. So if you're on medications, you're being treated for a medical condition, you need monitoring, or if you're doing it and you're not getting the success you want, or you're having side effects that don't go away with our kind of keto adaptation understanding, then that's another reason to get the medical monitoring, because there may be some other issue that pre-existed before you started.
A quick one. How would someone that is going to a doctor who doesn't believe in this type of lifestyle, what is your suggestion to them? So now a patient goes to their doctor, says, listen, I've seen all these wonderful videos, I've learned everything about this diet and how I can go off my medications, and he won't assist her or him in going and embarking on this program and monitoring the medications. What is left for that person?
Well, fortunately, more and more doctors are becoming aware of the keto approach because of the success that people are having, but it's a slow process to train all doctors about it. The best recommendation I can make is to ask the doctor to help monitor them, even if they don't believe in it. You don't have to teach your doctor or educate them. They will usually respond after they see your success. there are some videos and ways to help yourself to understand what to do, but ask your doctor to do the monitoring. Now, if the doctor is very resistant and says, no, don't do that, then you just say, well, can we agree to disagree about this, and can you still monitor me?
Okay. Fair points.
Most doctors will. I mean, occasionally, some doctors are so taught that eating fat is bad that they don't even have any openness to address a different method that works. So.
Well, that's fascinating. So I think in closing, we urge you that if you are on any medication for any of the conditions, either blood pressure or diabetes, any other condition that you can just think of throughout there, any other medications?
Well, those are the major ones, but I would think any medical condition, there are conditions with chronic steroid treatment or thyroid. These are all things that would probably need monitoring too.
So we urge you that if you have any of these conditions and you're currently taking a medication, please, before you embark on this type of lifestyle, please go and ask your medical doctor to monitor your condition and the effectiveness of the strength of the medication. Thank you so much. Thank you, Eric.
Thank you.
Thank you.